Hello and welcome. I'm Dr. Stephen Stahl, Professor of Psychiatry at the University of California, San Diego Medical School, and Honorary Fellow at the University of Cambridge. During this short video, I'll cover the pharmacological profile for REXULTI, Brexpiprazole.
Indications and important safety information for REXULTI, Brexpiprazole. Indications. REXULTI is indicated for use as an adjunctive therapy to antidepressants in adults with major depressive disorder, treatment of schizophrenia in adults. Warning: increased mortality in elderly patients with dementia-related psychosis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at increased risk of death. REXULTI is not approved for the treatment of patients with dementia-related psychosis. Warning: suicidal thoughts and behaviors. Antidepressants increase the risk of suicidal thoughts and behaviors in patients aged 24 years and younger. Monitor for clinical worsening and emergence of suicidal thoughts and behaviors. The safety and effectiveness of REXULTI have not been established in pediatric patients.
I'll begin with an overview of some general pharmacology key terms. With this video, I'll cover clinical pharmacology, pharmacodynamics, and pharmacokinetics. Clinical pharmacology is the science of drug use in humans. Important principles of clinical pharmacology are pharmacodynamics, the study of effects of drugs on biological processes, and pharmacokinetics, the study of drug absorption, distribution, metabolism, and excretion. In other words, pharmacodynamics is what the drug does to the body, while pharmacokinetics is what the body does to the drug. Throughout this video, you'll hear words related to these two principles, such as binding affinity, agonism, and half-life. What do these words actually mean when describing how a drug acts in the body? The video will first cover pharmacodynamics. Many drugs exert their effects based on their affinity or strength of binding for specific receptors where they can mimic or block the effect of what would naturally bind to the receptor. Agonists activate receptors similar to what would naturally bind to the receptor. Partial agonists have been shown to stimulate receptors to enhance their signaling, but not to the same extent as a full agonist. In the presence of a full agonist, partial agonists reduce the strength of various downstream signals. Antagonists compete with agonists for the same receptor, but without activation. When combined with the receptor, antagonists block the binding of an agonist, thereby preventing receptor activation. The video concludes by covering pharmacokinetics, in particular, drug elimination. A key term for pharmacokinetics is half-life, defined as the time required to reduce the amount of drug in the body by 1/2 during elimination. Now that I've covered some general pharmacology key terms, I'll begin discussing REXULTI's clinical pharmacology. REXULTI is a distinct chemical entity that is not an isomer or metabolite of any other compound. Brexpiprazole is the active ingredient of REXULTI. While the mechanism of action of Brexpiprazole is unknown, the efficacy of Brexpiprazole may be mediated through a combination of partial agonist activity at dopamine D2 and serotonin 5-HT1A receptors, and antagonist activity at 5-HT2A receptors. The pharmacodynamic profile of REXULTI includes its activity as an antagonist at noradrenergic alpha-1b and alpha-2c receptors. Now, let's review the information on the pharmacological profile of REXULTI. REXULTI has a similar range of binding affinities for receptors across 3 neurotransmitter systems. The binding affinity, or Ki, is expressed as a nanomolar concentration on a logarithmic scale. Lower Ki values at the top of the chart represent a higher affinity, while higher Ki values at the bottom of the chart represent lower affinity. REXULTI has the lowest Ki values, and therefore the highest binding affinity, for specific dopaminergic, serotonergic, and noradrenergic receptors. Serotonin 5-HT1A, 5-HT2A, 5-HT2B, and 5-HT7 receptors have Ki values of 0.12, 0.47, 1.90, and 3.70 nanomolar, respectively. Dopamine D2 and D3 receptors have Ki values of 0.30 and 1.10 nanomolar, respectively. Noradrenergic alpha-1b, alpha-2c, alpha-1d, and alpha-1a receptors have Ki values of 0.17, 0.59, 2.60, and 3.80 nanomolar, respectively. REXULTI has higher Ki values and relatively low affinity to muscarinic and histaminergic receptors. Another important part of REXULTI's pharmacological profile is the pharmacokinetic half-life of the drug. The pharmacokinetic half-life of REXULTI is 91 hours. Now that we've discussed REXULTI's pharmacokinetic profile, please turn your attention to the important safety information for REXULTI.
Indications and important safety information for REXULTI, Brexpiprazole. Indications. REXULTI is indicated for use as an adjunctive therapy to antidepressants in adults with major depressive disorder, treatment of schizophrenia in adults. Important safety information. Warning: increased mortality in elderly patients with dementia-related psychosis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at increased risk of death. REXULTI is not approved for the treatment of patients with dementia-related psychosis. Warning: suicidal thoughts and behaviors. Antidepressants increase the risk of suicidal thoughts and behaviors in patients aged 24 years and younger. Monitor for clinical worsening and emergence of suicidal thoughts and behaviors. The safety and effectiveness of REXULTI have not been established in pediatric patients. Contraindication: in patients with known hypersensitivity reaction to Brexpiprazole or any of its components. Reactions have included rash, facial swelling, urticaria, and anaphylaxis. Cerebrovascular adverse events, including stroke. In clinical trials, elderly patients with dementia randomized to risperidone, aripiprazole, and olanzapine had a higher incidence of stroke and transient ischemic attack, including fatal stroke. REXULTI is not approved for the treatment of patients with dementia-related psychosis. Neuroleptic malignant syndrome, NMS. NMS is a potentially fatal symptom complex reported in association with administration of antipsychotic drugs. Clinical signs of NMS are hyperprexia, muscle rigidity, altered mental status, and evidence of autonomic instability. Additional signs may include elevated creatinine phosphokinase, myoglobinuria, rhabdomyolysis, and acute renal failure. Manage NMS with immediate discontinuation of REXULTI, intensive symptomatic treatment, and monitoring. Tardive dyskinesia, TD. Risk of TD and the potential to become irreversible are believed to increase with duration of treatment and total cumulative dose of antipsychotic drugs. TD can develop after a relatively brief treatment period, even at low doses, or after discontinuation of treatment. For chronic treatment, use the lowest dose and shortest duration of REXULTI needed to produce a clinical response. If signs and symptoms of TD appear, drug discontinuation should be considered. Metabolic changes. Atypical antipsychotic drugs have caused metabolic changes, including hyperglycemia, diabetes mellitus. Hyperglycemia, in some cases extreme, and associated with ketoacidosis or hyperosmolar coma or death has been reported in patients treated with atypical antipsychotics. Assess fasting plasma glucose before or soon after initiation of antipsychotic medication and monitor periodically during long-term treatment. Dyslipidemia. Atypical antipsychotics cause adverse alterations in lipids. Before or soon after initiation of antipsychotic medication, obtain a fasting lipid profile at baseline and monitor periodically during treatment. Weight gain. Weight gain has been observed in patients treated with REXULTI. Monitor weight at baseline and frequently thereafter. Pathological gambling and other compulsive behaviors. Intense urges, particularly for gambling, and the inability to control these urges have been reported while taking REXULTI. Other compulsive urges have been reported less frequently. Prescribers should ask patients or their caregivers about the development of new or intense compulsive urges. Consider dose reduction or stopping REXULTI if such urges develop. Leukopenia, neutropenia, and agranulocytosis. Leukopenia and neutropenia have been reported with antipsychotics. Agranulocytosis, including fatal cases, has been reported with other agents in this class. Monitor complete blood count in patients with pre-existing low white blood cell count, WBC, absolute neutrophil count, or history of drug-induced leukopenia-neutropenia. Discontinue REXULTI at the first sign of a clinically significant decline in WBC and in severely neutropenic patients. Orthostatic hypotension and syncope. Atypical antipsychotics cause orthostatic hypotension and syncope. Generally, the risk is greatest during initial dose titration and when increasing the dose. Monitor in patients vulnerable to hypotension and those with cardiovascular and cerebrovascular diseases. Falls. Antipsychotics may cause somnolence, postural hypotension, motor and sensory instability, which may lead to falls, causing fractures or other injuries. For patients with diseases, conditions, or medications that could exacerbate these effects, complete fall risk assessments when initiating treatment and recurrently during therapy. Seizures. REXULTI may cause seizures and should be used with caution in patients with a history of seizures or with conditions that lower the seizure threshold. Body temperature dysregulation. Use REXULTI with caution in patients who may experience conditions that increase body temperature, for example, strenuous exercise, extreme heat, dehydration, or concomitant use with anticholinergics. Dysphagia. Esophageal dysmotility and aspiration have been associated with antipsychotics, including REXULTI, and should be used with caution in patients at risk for aspiration. Potential for cognitive and motor impairment. REXULTI has the potential to impair judgment, thinking, or motor skills. Patients should not drive or operate hazardous machinery until they are reasonably certain REXULTI does not affect them adversely. Concomitant medication. Dosage adjustments are recommended in patients who are known cytochrome P450 CYP 2D6 poor metabolizers and in patients taking concomitant CYP3A4 inhibitors or CYP2D6 inhibitors or strong CYP3A4 inducers. Most commonly observed adverse reactions. In clinical trials, the most common adverse reactions were major depressive disorder, MDD, adjunctive treatment to antidepressant therapy greater than or equal to 5% incidence and at least twice the rate of placebo for REXULTI versus placebo, akathisia, and weight increase. Schizophrenia, greater than or equal to 4% incidence and at least twice the rate of placebo for REXULTI versus placebo, weight increased. Dystonia. Symptoms of dystonia may occur in susceptible individuals during the first days of treatment and at low doses. Pregnancy. Adequate and well-controlled studies to assess the risks of REXULTI during pregnancy have not been conducted. REXULTI should be used during pregnancy only if the benefit justifies the risk to the fetus. Lactation. It is not known if REXULTI is excreted in human breast milk. A decision should be made whether to discontinue nursing or to discontinue the drug, taking into account the importance of the drug to the mother. To report suspected adverse reactions, contact Otsuka America Pharmaceutical Incorporated at 1-800-438-9927 or FDA at 1-800-FDA-1088, www.fda.gov/medwatch. Please see full prescribing information, including boxed warning, available within this presentation.
This concludes our video on REXULTI's pharmacological profile. Thank you for joining me.